Thank you very much. Can I begin by acknowledging the traditional owners of the land that we meet on this morning, the Wurundjeri people, and pay my deep respects to elders past and present, and also extend that respect to elders and First Nations people who are present here today. I'd also like to recognise people with lived and living experience who are here today and the critical contribution that you play to this sector. And of course, my deep thanks to VADA for hosting this event today and inviting me along to speak. And in particular, I'd like to acknowledge Tasman and also Chris and the whole team at VADA who do an enormous amount of important work. The theme of this year's conference, From Policy to People, centering communities in our response, couldn't be more timely, and it captures the work that we're all doing, bridging that gap between government decisions and the everyday realities for people, families and communities who are impacted by alcohol and other drug use. Because we know that behind the work that we do are real people reaching out for help, support and for hope. Every year, more than 40,000 Victorians access government-funded AOD services, something I know I don't need to tell any of you. That number tells us two things though. The need is really significant and so is the opportunity for impact. That's why our approach must be practical, person-centred and driven by partnership. This year, we're laying the foundations for the change we know the system needs. Victoria's first ever statewide alcohol and other drugs strategy. The strategy will chart a 10-year path to reform our AOG system so it's more connected, more culturally responsive and capable of meeting that driving future demand. The strategy will focus on strengthening our partnerships across government, across the sector, through our peaks and, of course, the community. And it will embed the voices of people with lived and living experience. It will elevate First Peoples' self-determined approaches to delivering culturally safe care that make meaningful change to the well-being of First Nations Victorians. And it will also support and grow a strong, supported AOD workforce, the backbone of the whole system. And you bring such invaluable insights and empathy to your work. I know that there have been many of you that are in the room today who've contributed your time and your expertise in the development of this strategy, and my thanks for that work. I know you're incredibly busy people, so it is much appreciated, and I'm looking forward to being able to share the strategy with you all very soon. We're continuing to back our vision with sustained investment. The 2025-26 Victorian budget delivers $380.8 million to prevent and reduce alcohol and drug harm. That includes targeted prevention and early intervention, expanded treatment capacity, harm reduction programs, and of course, stronger regulation. Since 2014, we've more than doubled our investment in AOD services. And while I acknowledge there's still much more work to be done, our efforts to date are making a difference. We've expanded and enhanced the outreach services in areas of high drug harm, including North Richmond, Footscray, St Kilda and the CBD. The City Street team provides outreach support 7 days a week now from 9 a.m. until 10 p.m. on weekdays and between 10 and 6 p.m. on weekends. We've got new mobile outreach services that have been established in Footscray and St Kilda, operating 7 days a week. And our enhanced trauma-informed outreach service in North Richmond operates from 8:30 a.m. to 9:30 p.m. 7 days a week, providing that critical support and intervention for people using drugs, as well as for people who live and work in North Richmond. These mobile teams are meeting people where they are, on the streets, in crisis and in need. We've also invested in wraparound care in the heart of Melbourne's CBD, including a $45.8 million investment for a new community health hub on Flinders Street and a $2.9 million investment for immediate supports for the Salvation Army on Bourke Street. These services bring together our GPs, our addiction specialists and mental health staff to help people access that coordinated care more quickly. Since opening in December 2024, the Bourke Street Clinic has already provided 911 instances of health and wellbeing supports, which is quite an impressive number in a short period of time. We're also strengthening access to pharmacotherapy because we know how critical it is, especially in regional Victoria. With $8.4 million in grants, 15 community health services across Melbourne and the regions will be expanding their pharmacotherapy offerings. And in a Victorian first, we'll be trialling hydromorphone as a treatment option for people who haven't responded to traditional pharmacotherapy methods. We'll also be launching a peer-led overdose helpline this year, the first of its kind in Australia. And our approach is grounded in harm reduction because people should be able to access the help they need without stigma. The medically supervised injecting room in North Richmond has now safely managed more than 10,000 overdoses. It's saved lives, it's eased pressure on emergency services, and it's provided thousands of referrals to health and social supports. We're now building on that success with an expanded model of care delivered by a new consortium, meaning more people will be able to access the right care at the right time, including critical mental health supports through a strong partnership with St Vincent's Hospital. And we're also expanding access to naloxone. More than 12,000 units have already been distributed through our take-home naloxone program. And we have the future rollout of 20 naloxone vending machines across Victoria in the pipeline that will save lives and people will be able to access that life-saving medication 24/7 in the areas of greatest need. And we've also seen our mobile pill testing trial become one of the most significant harm reduction efforts we've seen. At 5 major music festivals, more than 1,500 young people accessed free, confidential drug checking and harm reduction support, many for the first time. And the impact, more than 30% said they would reduce how much they planned to take, and over 65% said it was the first ever conversation with a health worker they'd had about drug safety. We also issued 2 drug alerts after detecting dangerous substances through our mobile testing over summer. We're now expanding that trial to include a fixed site service in Fitzroy, offering access to judgment-free, health-led conversations and trusted advice. And I just want to make the point, which I like to make over and over and over. This is not an efficacy trial because the evidence is already in on drug checking. This will become and remain a permanent feature of our AOD toolkit here in Victoria. We know when people feel safe to ask questions, they're more likely to make safer choices. That is why this is such an important public health policy. Another way we're building a stronger evidence-based system is through research and innovation. The Alcohol and Drug Research and Innovation Agenda, or ADRIA, is driving new thinking and building a stronger evidence base for the sector. Since its establishment, ADRIA has supported several strategically valuable projects aligned with sector priorities, helping to grow collaboration and capacity across our state. And I'm pleased to announce the 4 successful grant recipients in the latest round of ADRIA funding. Uniting VicTas will lead research to improve treatment outcomes for women undergoing residential withdrawal from GHB during pregnancy. Co-Health will investigate trauma-related mental health needs among people accessing opioid treatment services, including how consumers want those services delivered. Shark will explore how the lived experience workforce can best support people leaving prison and navigating the AOD treatment system. And Western Health will link health and justice data better to understand drug-related harms after release from prison and how we can reduce them. Together, these projects will receive just under $1 million over 2 years to generate insights that will strengthen our response. It will inform our future policy and ultimately lead to better outcomes for the people that the sector serves and indeed the whole Victorian community. All of this, our strategy, our investment, our services are designed to bring us closer to the people that we serve. But we know we can't do it alone. The AOD sector, your workforce, your organisations and your leadership are at the heart of these reforms. You hold the trust of your communities. You walk with people through some of their hardest moments, and you help turn policy into healing, hope and change. As Minister, I'm deeply committed to this work, and I'm absolutely committed to working alongside you and your organisations. From policy to people, thank you for everything you do to make that vision real, and enjoy your conference. Thank you.